Congestion, cough, and secretions are commonly associated with a number of pulmonary conditions, and we have some medications that we use to manage all of these. So to decrease congestion, we have decongestants and antihistamines. Now, decongestants are common over-the-counter medications. We use them all the time for the common cold or flu. They're generally alpha-adrenergic agonists, and they cause vasoconstriction by mimicking the actions of the sympathetic nervous system on the mucosal blood vessels. And by causing vasoconstriction, they decrease mucosal swelling and fluid leakage, thereby decreasing congestion. So, ephedrine is kind of the classic one, but pseudoephedrine is the most common one. And this is what's in pseudoephedrine and NyQuil and all those medications that we take over the counter to manage decongestion. Antihistamines are another category of drugs. Now, these work by a different mechanism of action. They block the H1 receptors on mucous membranes, and they prevent the action of histamine causing swelling and leakage of those mucous membranes. So, that decreases the runny nose, the congestion that we often experience with the common cold or with allergy attacks. So these are common drugs: loratadine or Claritin, Benadryl or diphenhydramine, cetirizine. These are all examples of antihistamines that we use to manage congestion and mucosal leakage. Suppressing cough. The category of drugs that we talk about are antitussives. Now, it's important to remember that when we have a condition that has a productive cough, where the cough is actually there to help us expel excessive secretions, we don't want to suppress that cough that's encouraged. We want to actually encourage that cough. Antitussives are helpful when we have that dry hacking cough that we sometimes experience that isn't productive, that isn't associated with excessive mucus and getting rid of that mucus. It's just an aggravating cough due to irritation of the throat or the airways. There are a couple of different categories of antitussives. Topical anesthetics, non-narcotics, and narcotics are basically the three types of antitussives that we see on the market. Now here we see an airway, and we see excessive accumulation of mucus or secretions here. And we can appreciate how that mucus plug, that excessive accumulation of secretions, decreases the diameter of the airway. And anytime we decrease the diameter of the airway, that's going to increase the resistance to airflow. It's going to make it more difficult for us to move air through that region of the lung. Additionally, the major function of mucus is to trap bacteria. And if we're not able to get those excessive secretions out of the lung, we can get an accumulation of bacteria, and that can contribute to the risk of infection. So, we have a number of mucoactive drugs that we use to try to facilitate the removal of those secretions. So, mucolytics are drugs that actually break down the secretions and decrease the viscosity in order to make it easier for us to cough it up. So, Pulmozyme is the one that is the most common that I've come across. And we see these often in people with cystic fibrosis and other conditions like that. Expectorants, they actually increase the water production. So they actually make more secretions, but they're thinner, so they're easier to get up. And Mucinex is something that you see ads for on the TV to help loosen up those secretions. Make them thinner so that we can cough them up. And nausea and vomiting are side effects for both of these medications. Here we have an airway that is filled with mucus, and that mucus is infected. So now we have pneumonia. And pneumonia is a major health issue, particularly for people with chronic lung conditions or just other chronic diseases, particularly in the frail elderly population. So, antibiotics are the major category of drugs that we use to fight infection. There are a number of different categories of antibiotics. So, aminoglycosides. So, this is a category, and here's a particular example of an antibiotic in that category, gentamicin. Cephalosporins is another category. Macrolides, penicillin, quinolones, and sulfonamides. These are all different categories of antibiotics. The exact category that is going to be used depends on the organism that is contributing to the infection. So that's something that would be decided by the medical team. But all of these are different examples of types of antibiotics.